In our cost of living series, we are talking to middle-class families about why it is so difficult to get by. We found only 14% of workers, many of whom work downtown here, only 14% of them are covered by a paid family leave policy, leaving thousands of families and workers scrambling.
At the Barrows home, life is crazy with a 3-year-old and a newborn. Mom Kate is on maternity leave. She's using accrued time and short-term disability to take 8 weeks off to recover from her C-section. But there's a problem. Her husband Adam was recently diagnosed with a spinal cord condition that will eventually put him in a wheelchair.
So that was kind of a big hit for us.
If my husband becomes ill again and his back worsens, then I will likely have to take more time.
To take care of her husband, Kate's likely only option would be to take unpaid leave, which would leave her family with no income. But there's more. Kate is living with postpartum depression. It's been on and off since the birth of her daughter.
I was having auditory hallucinations. You know, I thought I would hear a baby cry, and nobody was crying. Everybody was fine. And my doctor asked me, he said, "Do you need to go to the stress center?" And I thought, you know, I probably do, but again, I still didn't qualify for short-term disability. I didn't qualify for family medical leave, and I had already taken time away from accrued time I had.
But Kate didn't go to a treatment center because she did not have paid family leave. The Indiana Institute for Working Families says many families are in the same boat as the Barrows.
We have about 1 in 4 moms going back within 2 weeks of giving birth.
States like California, New Jersey, and Rhode Island already offer paid family leave, and it's coming soon in New York, Washington, and D.C. The Institute is pushing Indiana to follow suit.
Family leave often gets painted as maternity leave. It's just for new parents. But really, this is something that everyone could use because all of us at some point in our lives are going to need to care for someone in our family.
Of course, how do you fund something like this? Some employers foot the bill, and in states already using paid family leave, employees pay for it. It's taken out of your check, just like insurance. As for Kate, she's getting help for her postpartum depression, and hiking helps pull her out. With Adam's spinal cord condition and no paid family leave, the future is very uncertain.
It makes me angry, you know, and it makes me really upset that that moms have to go through this, that parents have to go through this.
And the governor just signed off on a study that will look at the impact that paid family leave will have on Hoosiers. The findings of that study are expected to be released in November. We're live downtown. I'm Call 6 Investigates' Kara Kenny.
An Eastside mom suffering from sticker shock contacts Call 6 Investigates for help. Chloe got a $33,000 bill in the mail from the hospital after the birth of her son. Call 6 Investigates' Kara Kenny is working for you, looking into how much it really costs to have a baby and what you can do if you get an unexpected bill like this. Kara?
That's right, Erica. According to this helpful tool, My Care Insight, the average sticker price for a C-section in Indiana is nearly $20,000. Of course, no one with insurance expects to pay that much. That's exactly what an Eastside mom was thinking. That is, until she got her bill.
Chloe is still trying to get used to life as a new mom. A month after giving birth at Community Hospital South, Chloe got this bill in the mail for $33,000. JD's face sums up her reaction.
I've never received a bill that large, so it definitely was a sticker shock.
Chloe was confused. She's paid her insurance premiums on time, and her out-of-pocket max is about $6,400.
I was under the assumption that we would just have to pay up to our out-of-pocket max.
It wasn't an easy delivery as Chloe planned. After the umbilical cord wrapped around JD's body, she ended up with a C-section.
You know, I don't mind paying my portion, but I just feel like the amount right now is unreasonable.
Chloe contacted her insurance company, who was able to help her whittle down the bill a little, but with a huge chunk left to pay, Chloe reached out to Call 6 Investigates.
I'm just hoping that the insurance and the hospital can come up with an agreeable amount that isn't so high.
Call 6 Investigates reached out to Chloe's Insurance, which is a self-insured employer-sponsored plan. We got a response from ELAP Services, a service provider on Chloe's plan. They initially blamed the bill on significant markups from Community Hospital South and said they were working diligently on Chloe's behalf to ensure a fair and reasonable payment. But Community Hospital tells a much different story. The hospital says insurance plans like Chloe's do not contract with hospitals regarding pricing agreements. Instead, they attempt to negotiate pricing after services have already been provided, oftentimes putting the patient in the middle. Hospitals across Indiana have raised concern that this practice places patients at risk for not being covered for the services provided. The Indiana Hospital Association shares the concern.
This kind of new type of insurance we're seeing more and more in the marketplace is resulting in more and more of these unexpected bills. I can't speak to a particular case, but I think we are seeing more cases where what the individual thinks is insurance is not truly insurance that has a contracted rate with a provider.
A few weeks after Call 6 Investigates started asking questions, Chloe got an update. She now only has to pay $5,600, a far cry from where she started. Consumer law attorney Keith Hagan says you have more power than you think to reduce your hospital bills.
They would rather have money in hand than try and pursue through the courts for money they can never get. So if you can come to a negotiated amount with them, always try and negotiate. The worst they can say is no.
Chloe is now staying at home full-time with her baby.
We're definitely more budgeted now.
She's relieved to not have a giant bill hanging over her head and instead can focus on her family.
Now, ELAP Services declined to go into detail about how Chloe's bill was marked up, but they say the hospital provided additional information that allowed them to reach a fair and reasonable outcome. Now, before you have a procedure, the Indiana Hospital Association says you should go to My Care Insight. You can put in your zip code, the hospital, or even your condition. Get that information and then go back to your insurance company so you can get a handle on how much it's actually going to cost you out of pocket. We're live downtown. I'm Call 6 Investigates, Kara Kenny.
So many parents, the struggle is real. And tonight, Call 6 Investigates is digging into why the costs are so high and where you can go for help. Our Kara Kenny found middle-class families may qualify for assistance and may not even realize it.
Let this sink in. Child care for a baby in Indiana is $9,000 a year. That's more than sending your child to an in-state public college.
Beth Riedemann is a single working mom. She takes her 3-year-old son Gray to Little Dove, a registered ministry on the east side. Beth pays $420 a month.
I own my own home, and that cost of childcare is more than half of what my mortgage payment is, so it's a big chunk of money.
Beth makes about $50,000 a year, too much for this middle-class mom to qualify for state and federal programs. But she does get a discount. That's because Little Dove offers a sliding scale for parents based on the number of children and income.
The cost of childcare is one of the main things that we run into with families as far as what they're looking for. The first thing they'll ask us is, do you have availability? And then the next question out of their mouth is usually, how much is it going to cost me?
Child care directors tell Call 6 Investigates running a facility is expensive. You have to pay and train the staff. Then there's the rent, utilities, insurance, and don't forget things like toilet paper, snacks, and meals for more than 100 kids. Many child cares like Loving Hearts on Indy's South Side use grants, fundraising, and volunteers to try to keep fees affordable for parents.
If we have anything to do like spreading mulch on the playground or painting a classroom, we ask for volunteers for that to try to help keep our costs down.
Statewide, the cost of childcare has gone up $1,000 over the past 5 years. Parents may qualify for programs including On My Way Pre-K, Early Head Start, and CCDF federal vouchers. Southside mom Sharita Stevenson says she made too much money to get CCDF.
Childcare is extremely expensive.
But she did qualify for the On My Way Pre-K program, and now her daughter Mackenzie attends Loving Hearts for free.
The cost would be about close to $200 a week, if not more, and so we've been blessed with the scholarship. However, I don't know that we could afford that.
Many parents may qualify for help and may not even realize it. The Brighter Futures State Hotline can help you.
All right, in the Mishawaka area.
If you make too much to qualify for state or federal programs, they can help you find childcare with sliding fee scales. For Beth and her son Gray, every bit of savings helps.
We've compiled a slew of resources on this story on the RTV6 app, including where you can go for help. I'm Call 6 Investigates' Kara Kenny.